Opportunity to spend a little time with Dr. Leo H. Bartermeier, whom I think by any standard would be considered the central figure in psychiatry in the Detroit area for many, many years. We want the opportunity to hear from him about his own personal life and his experience in the field of psychiatry and analysis and the kind of personal element that he can bring to our understanding of our own background. Dr. Bartermeier, perhaps it would be best if I gave you completely free rein. How did you come to this community? What has life been like?
After I had completed my internship at Henry Ford Hospital, I entered upon a 3-year residency in internal medicine at that hospital. And this brought me into working closely with Dr. Frank Sladen, who was the physician-in-chief of the hospital. And it was through working with him and sharing his interest in the psychological aspects of medical practice, the social aspects of medical practice, that we both came to see the need of a department of psychiatry at the hospital. Now, this would have been about 1923 when the American Psychiatric Association was meeting in Detroit. So Dr. Sladen suggested I go down to the meeting and wander about and see if I could locate any psychiatrist who might be interested in coming to the hospital. It was there that I met Dr. Thomas Helt and persuaded him to come out to the hospital and have an interview with Dr. Sladen.
Is that right?
And this resulted in his appointment and the establishment of the first section on one of the first sections on psychiatry in a general hospital in the United States. Well, continuing my work with Dr. Sladen, sitting at his side while he's taking the histories of patients, it became obvious that he was interested in the family of the patient, the neighborhood in which the patient lived, and how they got along together in the family. He was interested in family relations. He was an unusual internist who had come from Hopkins, and whereas my interest in psychiatry developed through him. He was my inspiration.
Is that right?
In addition to my own personal needs, which of course I didn't see at the time. So I left Detroit then in 1924, having come here in 1920. And I went on Dr. Sladen's recommendation down to Adolph Meyer at the Henry Phipps Clinic, Johns Hopkins Hospital. Well, I had 2 years of training there in neurology and in psychiatry, and at the end of that time came back and opened my office in General Motors Building, July 1, 1926. Patients whom I had worked with at Ford Hospital began to follow me into private practice, and I was never without work to do with patients and families. And I continued then until 1930. Now, during those 4 years, I became very much interested in Dr. Barrett at University of Michigan. He was the chairman of psychiatry, Department of Psychiatry, and as early as 1910 or 1912 was teaching his medical students the basic principles of psychoanalysis. He was one of the first teachers of psychoanalysis in psychiatry, and I remembered this and included it in my paper on contributions of psychiatry to psychoanalysis, which I read at the centenary celebration of the American Psychiatric in Philadelphia in 1944. I was very much interested in Barrett, and I think he was in me too. It was about, and I oftentimes went out there for meetings of his staff. And he always came into Detroit for these meetings of the Michigan Society of Neurology and Psychiatry. I don't remember it was called that at the time. But you know, it was just a short time before that Ernest Jones, who was practicing in Toronto, used to take the train and come from Toronto the day before, put up at a hotel, attend this meeting of this small group. There couldn't have been more than 6 or 8, possibly 10 people. They'd have a dinner and a scientific meeting, and the following morning Jones would take the train and go back to Toronto.
For goodness sake. And
it was a very interesting group. And Barrett, of course, was one of the presidents of the American Psychiatric Association. Barrett was the physician who discovered the spinal cord changes in primary anemia. He was known for that. And he was a powerful figure in the faculty of the university. Psychiatry was moving forward at a fine rate, and he was training any number of people. And I got to know Theophil Raphael, who was already beginning to work in student mental health. And but I became dissatisfied with my practice because while I could help people to get rid of their symptoms, which I think were dissolved in the transference, the symptoms would return. I couldn't help people to be permanently rid of their neurotic disturbances. And this dissatisfaction was present when I attended the first international meeting of the Mental Hygiene Organization in Washington. And you know, that was 1930 in the spring. And at that meeting, people like Helena Deutsch, people like Franz Alexander, were invited on the scientific program. The meeting was held in Washington, lasted several days. At that meeting, I was sitting next to Carl Menninger, and we began talking about having an analysis ourselves.
he had not yet entered the field of analysis.
So that was the spring of 1930. Well, we had interviews with Alexander and got his promise to take us into analysis when he became the first professor of psychoanalysis at the University of Chicago. And so I began my personal analysis with Franz Alexander on October 1st and had my first trip in an aeroplane, which was a Ford Tri-Motor, which stalled somewhere in flight, and you can understand how frightened we all were. But anyhow, I arranged with Alexander for my analytic hours in such a way that I could also continue part-time my practice, because by this time I had a family, I had a wife and children.
Living in
My
Detroit.
office in General Motors building, living here in Detroit, and having my analytic hours on Saturday, Sunday, Monday, and early Tuesday, and then fly back to Detroit and practice until late Friday night, and then go back to Chicago and continue this for a year.
Isn't that amazing?
Carl Menninger, on the other hand, he would go back and forth between Chicago and Topeka. Not as often. He didn't continue in practice while he was in analysis because naturally he had people on his staff who could practice. Now, in order to ensure a continuity of patient care, I asked Dr. Levine, Alfred Levine, to share offices with me and to take care of any emergencies in my absence. This began my analytic career.
Mm-hmm. Now, at what point would you say, except through yourself, did other analysts begin to take hold and participate in the Detroit area?
There was no other analyst here. I was in isolation for 10 years.
For 10 years?
Almost 10 years.
Well, now, how did this change come about? What
the change came about through, you see, Dr. Barrett had intended that Dr. Dorsey would succeed him. And Dr. Barrett recommended to Dr. Dorsey that he go to Vienna and be analyzed by Freud.
Which I believe he did, right?
Mm-hmm.
And then he did in 37 or 38 somewhere.
Yes, but while he was in Vienna, or when he was about to return, Barrett died. Well, everyone expected that Dr. Dorsey would become the professor of psychiatry at the university, naturally. And everybody was surprised that Dr. Wagner was appointed. And people thought that Dr. Wagner was a neurologist from Philadelphia, that he was not a psychiatrist. But we know that people were wrong about that and that he proved to be a very wonderful professor.
And has developed a fine department, outstanding department.
Yeah.
Now, this would then have also brought about others coming into this community. This was right before the war then?
Yes.
Really?
This was well before the war. There was Dr. Norman Tufford had been analyzed by Dr. Edward Glover. Dr. Tufford came back. Dr. Dorsey came back. The three of us would meet regularly and read Freud's works, his collected papers, at each other's homes at regular intervals. And then Dr. Clara Hoppel came. And by 1935, that's 5 years, I had completed my analytic training. Now, my analytic training, by that I mean, I had done supervision, had been supervised by Dr. Lionel Blitzton and Thomas French in Chicago, which necessitated continuing going back and forth from Detroit to Chicago at almost weekly intervals for 5 years.
For 5 years.
Yeah.
Isn't that remarkable?
Yeah.
So traveling for an analysis is not something of recent vintage.
That's right.
That goes back a long time.
That's right. Well, Dr. Dorsey came back from Vienna. He became included in our group. There was Dr. Clara Hoppel. Dr. Ulrich came up from Cleveland he came up from Cleveland occasionally. And Dr. Finlayson, Alan Finlayson, who was also from Cleveland, he was in his training with Dr. French.
I see.
Now, I can remember Dr. Finlayson flying up from Cleveland and my meeting him at the city airport and bringing him to my home out on 18 Mile Road, Strawberry Hill, and having dinner, and he and I then driving north in Michigan to maybe Ludington, where we took the overnight boat into Wisconsin and then drove to Ephraim, Wisconsin, where Dr. French was having his summer vacation. And Dr. Finlayson had an hour with Dr. French, and I had an hour, and then we turned around and came all the way back.
That's devotion.
On another occasion, I had an hour of supervision or more with Dr. French, and he was late in getting here from Chicago and suggested that we have the hour on the boat between Baltimore and Buffalo. And it was a very stormy trip. And but we got through it all right. And having done that, I drove back and went right back to practice again.
Now, did anyone from the Chicago area come to Detroit?
Well, Dr. Alexander came to lecture to the Medical Society and Michigan Society of Neurology and Psychiatry. Dr. Blitzton, Lionel Blitzton, he came. You see, Dr. Helen McLean, Carl Menninger, and I were the first three analyzants of Dr. Alexander.
Upon his arrival here.
And my analysis lasted 1 year, at which time Alexander thought that I had had the maximum benefit, but apparently I hadn't. And this showed up in my supervisory hours and showed up in my general behavior. I was getting involved in automobile accidents. And it became obvious that I had to continue analysis, and not with Alexander. Well, I couldn't go to Hungary because I was already too involved financially and had to continue the support of my family. So I went to New York and saw Dr. Harry Stack Sullivan and began my second analysis, which then lasted approximately 2 years by traveling between Detroit and New York.
This is amazing.
No.
It's amazing because at the time when I was completing my training, I was traveling back and forth to New York also, and I thought I was the first one who would ever...
Well, it was unusual because Harry Stack Sullivan, he and I knew each other. We knew each other very well.
Where had you come to know him?
Huh?
Where had you...
I had come to know him in 1926 at Johns Hopkins Hospital.
I see, when you were studying there.
But I'd had very infrequent contacts with him over the years. And so when I came to him and asked him to take me into analysis, he was a bit reluctant to do so. He was already involved with the Alan White Foundation and had a lot of things to do. And now, in order to save me time of travel, I would arrive in New York on Friday evening and have 3 continuous hours Saturday morning, 3 continuous hours Saturday afternoon, 2 continuous hours Saturday evening, and repeat that on Sunday, and then start back to Detroit.
Goodness sakes. Now, your life in psychiatry and in analysis has involved the presidency of the American Psychoanalytic. I'd like to know a little bit of this side of your career.
Well, in